Welcome to the Ortho Joe Show, a joint production of the Journal of Bone and Joint Surgery and Ortho Evidence. In our world, orthopedic research is king, and current topics from our respective publications are analyzed weekly. Here is Mohit Bhandari from Ortho Evidence and Mark Swinkowski from the Journal of Bone and Joint Surgery.
Well, Mo, good morning.
Morning.
Cheers.
Yeah.
Gotta have the Joe. No doubt about it. It's
yes. One is never
early
enough.
in the morning, early in the year, and we got to be caffeinated in order to carry on, as they say. And this particular episode, I have to give 100% of the credit to you coming up with the idea of taking a look at what we think might happen in the calendar year 2022, and then going back after it towards the very end of the year and seeing if the predictions turned out to be true. So since we're primarily interested in scholarly works and research and things like that, I think that's the way I've combined my three predictions about what we're going to see in 2022. And perhaps you have something slightly different, but let's just do the format. You start, and then I'll do one, and then you do one, and I'll do one, and let's go from there. So what's going to happen in 2022?
Well, let me first begin by saying that anytime I watch someone predicting the future on television, I look back and I laugh, think, fools, they're never going to get it right. You just can't figure it out. So I completely understand that those listening in are going to have their own viewpoints on this, but let me provide context to you, Mark, and let me try to convince you that we are going to see and we're already seeing it. So I think what we've been seeing, it's going to be accelerated, is how we organize data and how we use data. So what we conventionally used to think as the hierarchy of evidence, which is, you go from the observation to the case series, to the cohort study, to the penultimate randomized trial, and then using multiple studies to do meta-analysis. That's kind of been what we would consider the standard approach, right? The convention. But you're seeing that ripped apart. You're seeing bigger and bigger data sets. We're starting to see most companies providing wearable technology. We're starting to see virtual reality. We're starting to see all this other data that's coming on board. And the question is, I think the word for 2022 will be algorithms. It's going to be how we create a set of rules to guard a series of calculations to help us solve complex problems. And the individual or groups that are able to mine this massive amount of data across, all the different forms of data, whether it's user data, whether it's data from individual studies, or data coming in from large administrative databases, wherever that's coming from. I think that is going to be a big part of where some of the new breakthroughs are going to be. People always say, what's the next thing? I don't know what the next thing is, but if you look even back 3 or 4 years, this wave has been coming, and it's a tsunami now, right? Data is the tsunami. It's the currency of the century. So for me, it's going to be algorithms, and however we frame that, whether it's through AI, machine learning, but I do believe there's going to be a major push in that area.
That's a great start, and I certainly agree with that. We're seeing that in submissions, et cetera. But I've got this one doesn't count, but it's a little more personal, because I know that you have spent a lot of time emphasizing balance in life and smelling the roses. And so I'm going to predict that you're going to set a personal record in every downhill mountain bike course that you take on this year, and have the lowest score in Frisbee golf that you've ever had. So I'm going to come back to that at the end, but that's not one of my three. Okay.
I love that.
So I'm thinking about just submissions in the broadest sense. I am going to predict that we're going to see an enhanced number of submissions in rehabilitative strategies following whatever, injury, surgical procedure, whatever, a focus on how we can get more precise in getting patients back to the highest level of function with whatever, physical therapy, modalities, return to sport formulas, etc. That there's going to be an increasing emphasis on rehabilitative strategies that we see submitted in 2022. So that's my number one. I don't know whether you agree with that one.
I fully do. In fact, if if we can go back to one of our earlier discussions, where both of us have talked about hip fractures for many a decade. But the big shift has been, even in us doing the studies, has been real innovation, and I say real meaning a meaningful impact. So there'll be lots of trials done on hip fractures in the future, but I think the big impacts that we're going to see are going to be in the preoperative and postoperative arena, which is going to be not directly related to the type of implant we're using, maybe not even related to the specific surgical technique. I think it's going to be related to all the other things around that patient, all the other, multidisciplinary inputs that we often don't always optimize. That's, I think, is going to be a big part of care. So I think I would be fully in support of that. And I think that's a great start to an important prediction. Okay,
what's your number 2?
So this one really gets back to, I think, behavior. And I think, looking at, and this has just been reflective. So if I look at what I would consider to be our generation versus the generation born in the 80s, the millennials, versus the 95 and onward, which is the Gen Z, very different in terms of how we're approaching research, how we're approaching collecting data. But if you think of research as one example, it used to be historically that, what you would do is you'd start off and you would go with the idea of, I will, I'll get a job, I'll put in my time, from the time in, I'll get my master's and I'll get my PhD, and you'll just kind of go through this linear process. And everything that's coming out, and I think particularly heightened in COVID, has been this concept of polywork, or I'm not gonna do that route. I'm not gonna wait 20 years to get this thing. I'm gonna go right in on it. So why can't I start off doing trials? Why can't I just start collecting data on my own? And why can't I have all the insights I want without having to wait 10 years to get all these other degrees? I do think we're seeing a movement. And our academic systems, I think, are going to have to adapt rapidly to that. So whether it's all going to happen this year, I don't know. But I can tell you, we are seeing more and more of our future surgeon scientists really having, for lack of a better term, side hustles. They just know that they have many other things they're good at, and they're leveraging multiple things. So research, if we want research to become a really important side hustle, if we want journals to garner the best of the resident side hustles and the surgeon side hustles, we're going to have to, I think, adapt in a different way. I think we're going to see more and more. I'd say right now, if you look at the general population, they say somewhere between 1 and 2 individuals working feels that with the job they're in isn't ideal for them, so they're already thinking about switching. What's really fascinating about millennials in the Gen Z world is they're not even thinking about switching from, hey, I'll move from orthopedics to plastics or plastics to ortho. It's like, I will leave medicine altogether to pursue an entrepreneurship in something else. Like, it is, I will leave the industry. That type of risk-taking, and I almost can say confidence, is, I think, the mindset that we have to be thinking in research, is how we're going to get research to also have, build great ideas and do more things. And I think it's going to be more people not focusing on one topic. But I bet you, if we look back and look at authors over time in the next year, we'll see many authors doing multiple things, in fact, involved in all kinds of different things, because their interests are kind of poly-interested in a way as well. So, if we were to look back, I think we're going to see a greater variety of topics coming out, but more importantly, we're going to see single individuals investing in more than just one core focused area. They're going to branch out a lot more than they have, and we're going to see lots more of this. And I think the more we can find ways to encourage that, may lead to actually better breakthroughs for us in the field of surgery and medicine.
Yeah, I agree with you on that. Last night I did a journal club here with the Harvard residents, and one of the articles that we reviewed was on the generational impact in orthopedic education. And there was a robust discussion among the senior faculty and the young residents about differences in priorities, in the way they think about the future, et cetera, et cetera. And I couldn't agree more. It is going to be less traditional, shall we say, and perhaps that word is going to be eliminated.
Well, it's interesting. Okay, so see if these two sentences resonate with you, because they resonate with me a lot. whoever we called older generations, but I feel I'm part of it, the way they're speaking this particular quote. Older generations entered the working world with the expectation of a job for life, scaling up the career ladder within the same company. That's very much what, I mean, if I look at my own life, I've been at Mac. I'm a lifer at McMaster, and I've just worked my way up, so to speak, over time, and just said, there's no race to the top. Look at those individuals that are born in the 80s and probably in the late 90s. They don't seek jobs for life, but roles which allow them not only to work flexibly, which is a big plus right now, but also obtain multiple roles with different industries. They're basically saying, if I'm good at something, why can't I, as a researcher, why do I have to work for Mac? Why can't I work for 5 institutions and take my skill and work at 5 institutions a couple of days a week? And I get to, and whatever I'm learning, I can get from all those institutions. The concept of you're hired as a researcher for 1 institution versus 5 institutions hiring the same individual. I mean, that is what's happening in the workforce.
Yeah, I couldn't agree more.
So
let me go to my number 2. We have seen a trend, I would say, last 18 to 24 months in increasing submissions regarding the impact of patient characteristics in terms of mental health and personality on the influence on surgical indications and outcomes and the ability to comply with post-intervention instructions, et cetera, et cetera. And I'm going to predict that trend is really going to explode in 2022. Much more detailed analyses of patient mental health and personality characteristics impact on the whole process of care, from the selection of a treatment intervention to the management of the post-intervention phase, et cetera. So I don't know if you agree with that one.
Oh, well, again, another great choice. I can tell you that, and it brings me back to a collaborator of ours that we both work with, but now has done lots of work in the area of pain and disability. Jason Bussa works at McMaster right now, but he was involved in analyzing some of our flow data set, Mark. And you may recall that when we did the flow trial, we had a couple of thousand patients with trauma, and there were multiple times where some of the outcomes weren't necessarily predicted. In other words, everything went perfect, but the subjective outcome in the patient was very, very poor. But we had collected this tool he was developing called the SPOC, which is the somatic preoccupation tool, which basically gets to the point of, what is your general perception about your condition and about life? Are you generally more optimistic or pessimistic? How are you feeling? That one particular score single-handedly just erased every other prior predictor of trauma outcome. And it was like an awakening in a way to us, thinking, wow, we are capturing this. And the bigger issue became is, well, what do you do if someone has issues beforehand? You don't withhold treatment. So it raised not only issues of awareness, but also ethics, which I think probably is going to be another big area of understanding how do we help optimally those individuals in which the predictor is nothing, it's not something that it's either a psychological predictor or a mental health predictor. But no, it's great. And I can totally see how that's been exacerbated in the last 18 months.
Yeah, I've been telling the residents for the past few years that they're going to, in the end, be as gifted or as preoccupied, I guess, with social psychology as they are with techniques for orthopedic procedures in order to optimize patient outcomes. So what's your third one, Mo?
Well, I was going to say to you quickly is that, what we used to always be told are the quote soft skills. Well, you've got to communicate better. You have to be able to understand people's, your patient's feelings and make sure you do shared decision making. Those are all soft skills. When you realize that you do enough, it's hard. Those are the hard skills. They are the absolute, very difficult, quote, hard skills to pick up. So I think the direction is the right one. But further, and my last point is, it's more of a hope more than a prediction. But I hope that individuals, through the work that's happening also at the JBJS with your arts and humanities, will have an awakening in 2022. I think there's been lots of awakenings happening in our faculty, in our membership. That is the orthopedic fraternity worldwide. This idea of, what happens when everything shuts down? What happens, what really matters in the end? And how do we actually extract the most out of what we're here to do at the broadest level. So, the concept that I hope we'll see more of is more individuals opening up about the realities of how they are maximizing the skills that they have, and following to a greater degree, quote some of their, I'll use the P word because it's the passion word, but maybe it's not, maybe not following the areas that they find of interest as a way to make themselves better and whole in their day-to-day lives. Now, how do you actually, I hope that happens. How would we test that in a year? I don't know. I'm hoping that the humanities section of the journal will start seeing more and more people. But I can tell you anecdotally that since the arts and humanities section has just come out, the number of personal emails that I get, and I get one about every other day with a picture of that section and saying, I made sure this is mandatory reading for my trainees, and we talked about this. And by the way, I'm picking up my guitar, or as I know a colleague of ours, or I'm going back to doing X or Y and Z. So I hope we'll see more stories like that, which I think will actually make our field even stronger and better.
Yeah, well, I want to thank you again for your leadership in that whole area, and you really have provided the orthopedic community with a great example. Thus my comment earlier about going fast downhill on a bicycle and
well, you see, the way to go fast, I think, if my physics serves me right, is just gain a lot of weight. So I'm just gaining lots of weight because gravity will be my friend on the way down. I will not speak to anything else. I will not climb on a bike, but I will take a chairlift up and happily wee all the way down. It'll be fun.
Newtonian physics. Newtonian physics as an eternal truth. Well, my last one is rather, I guess, specific, but I just read yesterday in JAMA a big cohort of 1-year outcomes following COVID with younger age patients all the way to older age patients, and 25% at 1 year having musculoskeletal aches, pains, or joint pain. And my prediction is we're going to understand the physiological basis behind what that's all about, the so-called long COVID, by the end of this year. We're going to have a lot more information. We have a member of our editorial board, Kostas Melitsos, from Greece, who's particularly interested in this topic and has written an editorial. I think we're going to know more about what that's about and hopefully how we can intervene during rehabilitation, which gets to my first, I guess, prediction about how to prevent this. So
yeah, and I was a little deliberate to stay away from COVID because, and not that I don't think it's going to be hugely important for us in 2022. It was more thinking about, okay, well, what would be the impact except, for other potential waves and things like that. But I do think, if I were to add to your point, what little we have done and know about long COVID is just the tip of the iceberg. And I think you're absolutely right. There's going to be a host of new quote data, which gets back to, I think, how we're going to analyze all this information and the ways in which we'll pick up this information, I think will be particularly important. So I fully agree. I hope that in 2022, by the end of this, we're not talking about COVID. I genuinely hope that we've moved on and it's endemic. It is what it is. But right now, you're right. I think there's a lot of focus on this. And I can tell you on OrthoEvidence, anytime we put out a new piece that relates to either long COVID specifically, it is, it's high interest to the community. So clearly, I think many of our viewers, listeners are thinking the same things that you are, which is, what are the long-term consequences and what are we going to be prepared for them?
Yeah. Well, it's been fun talking about these predictions, and I'm sure you'll see to it that we come back to it at the end of the year and see how good we were. And I'm sure you also have creative ways to manipulate whatever information come out so that we're both really, really smart. So
that's right. I'm going to find ways. I'm
confirmed as being really smart by your analysis, Mo.
The best gurus are the ones that actually take 2 takes. So now what I'm going to do is I'm going to take another take with you, and we'll do a whole bunch of different ones. And eventually, one of them's going to work out, and that's the one we're going to put live and say, "See, we told you that was going to work." If you say Tampa Bay is going to win, and then Tampa Bay is going to lose, you're right. But anyways, it's all good. It's all good.
Yeah. Well, thanks for a great concept, and have a great day.
Yeah, you too.
Yeah.
Take care.
Cheers.
Bye.